I came across TeleTracking around 7 years ago, where I was doing some research because I worked in an acute hospital at the time, and I decided that managing our beds using pencils and rubbers and clipboards and bits of paper in order to try and move our patients around wasn't very efficient. So I went looking at how we could do this in a better way so that we deliver better care for our patients. I've now delivered and deployed TeleTracking in 2 NHS trusts where we've seen significant benefits to our patients.
The real-time location system is a badge that's allocated to patients when they come into the hospital. So we give them a badge on a wristband, a specific number is allocated to them. If a patient then goes off for a procedure, a porter will type into their little device to say that they've taken a patient somewhere, and it will update our central control system, and it will update our system here to say that the patient has gone off to theatre or to CT or wherever they've gone. When a patient goes home, the badge is removed and put in a drop box. That drop box then says that the bed is empty. This then triggers a call to the bed cleaning team, who then come and clean the bed and make the bed for us, ready for the next patient.
We know now that nurses are spending longer looking after patients rather than on the telephone, filling out bits of paper, requesting porters, requesting cleaners. It allows, for example, nurses to be nurses and allows us as the Care Coordination Centre to facilitate moving patients on their journey through the organisation from the emergency department, for example, to one of their base wards.
I think it's great because I have control over the whole hospital, all the wards on one screen at present, so I can then see where beds are available, where beds are going to become available within the next 3 hours. We have a census that we can use there. Potential discharges, I can then plan and map patients from ED into the correct beds in a timely manner.
The technology has impacted my workload for the better. It has freed up patient care time, allowing us to spend more time providing care for our patients.
For making sites easier to use from the site perspective, the ward nurses are really engaged with this. They're putting the correct data in, which makes it a lot easier for myself to use and my team.
When we look at quality, when we look at the times that patients are waiting for their beds, we've dramatically reduced that time. But when you're waiting for care, you just want to get to the place that's going to deliver that care. And we're doing that for patients twice as fast now as we could before.
We want to work in partnership with TeleTracking as to how we can expand the current offering. The obvious things for us to do straight away are think about how we use our community beds, our hospice beds, for example, and start to facilitate those people that are leaving the hospital for their onward journey of care. And if we can use the lessons from TeleTracking and bring those into our partner organisations, again, that removes wasted bed time and gets patient out to the next stage of their onward care.
So if you're thinking of adopting this technology, I'd definitely say go into this with a positive mind, adapt the change and go with it.